Possible budget cuts in Washington, D.C. will have a direct effect on the Flathead Valley, including health care for those who need assistance that otherwise wouldn't be able to afford it. Katy Harris found out what that would mean for local health care programs.
Federal budget cuts could impact health care programs in the Flathead Valley, including WIC, a nutritional supplement program for women, infants, and children. Cuts could also affect Medicaid, the medical insurance for those with low income.
You know, this is a federal budget issue. All of these decisions that are being made in Washington right now are going to have a direct impact on public health services in Flathead County.
WIC could see a 30% budget cut, which would mean a reduction in staff and those that are eligible for its services. 70 to 90% of funding for WIC goes towards employees' wages. WIC would also have to reevaluate who would need help the most with the reduction of resources because of its budget cut. Medicaid budget cuts can narrow the margin for those who are eligible for health insurance. That could lead to fewer individuals receiving health care because they wouldn't be able to afford the services without Medicaid. Some moms that rely on WIC and Medicaid can't imagine what they would do without those programs if they were cut, and they would no longer be able to receive assistance. One mom says she and her husband would have to go without medical insurance if their Medicaid was cut.
It would eliminate our ability to have preventative medical care, and that's when you wind up in the ER with something that really could have been avoided.
The health department says if the federal budget cuts do happen, they'll do the best they can to keep services available to those that need them.
And we'll continue to do everything we can to provide public health services in the community. But it may be with less staff, and it may be with less resources.
Budget cuts could have a direct impact on the Flathead Valley, but Russell says compared to other states, Montana is actually doing very well.
When it comes to the budget, you know, the state budget, we're one of the healthier states out there. A lot of states have been cutting way more than, as a percentage, way more than Montana has had to look at.
Russell says WIC and Medicaid do so much good for the community that it would be a shame to see them cut back from those that need it. Reporting in Kalispell, I'm Katy Harris for Montana's news station.
The health department will know in a few weeks if WIC and Medicaid will have their budget